Today's topic is ankle injuries and common basketball injuries. We have just started basketball season in high school and professional basketball as well as college. The single most common injury in basketball and in all sports is an ankle sprain. But it's important to get the diagnosis that it is an ankle sprain. 95% of ankle sprains involve the lateral or outside aspect of the ankle. When there is pain on the inside of the ankle, there is more likely to be a fracture or a stress fracture. Pretty much all medial ankle sprains or inside ankle sprains require an X-ray. We grade ankle sprains into mild, moderate, or severe. A mild ankle sprain, one may only need to miss a couple days to a week of physical activity or basketball. A moderate ankle sprain means that there's partial tearing of the ligaments that stabilize the ankle. A severe ankle sprain involves tearing of the ankle ligaments. This may require 2 to 4 to even 6 months of recovery before the athlete goes back to playing basketball or the sport. The most common cause of an ankle sprain is an inversion injury, such as jumping up for a shot and landing on someone's foot, or jumping up and just landing on the ground awkwardly. Whether it is a mild, moderate, or severe ankle sprain, it's important to start active rehabilitation, and that could take the phase of doing resistance bands or range of motion exercises. What happens when one has recurrent ankle sprains, 2 or 3 in a year or more than that, one lacks neuromuscular balance or neuromuscular appropriate firing patterns of the ankle. The most important part to prevent that and to treat that is to do jump training exercises once the athlete is pain-free. These jump training exercises should be done twice a week, not more than that. An additional topic to be discussed is distinguishing between ankle sprains and fractures. If we're looking at children under the age of 14, they're often in a rapid growth spurt. So often an ankle sprain can be diagnosed as an ankle sprain, but when in reality there's a growth plate fracture. So any bone tenderness in children 12, 13, 14, an X-ray should be taken and sometimes an MRI to make sure there's no associated fracture. If the diagnosis is an ankle sprain, a mild ankle sprain, if the athlete can run and jump functionally with minimal pain, they can play basketball or do their sport. But if there's a growth plate fracture, even if there's minimal pain, they should not be doing the activity. So it's important to see someone who's familiar with the age group at which you're dealing with and to come up with the correct diagnosis, whether it's an ankle sprain or a fracture or a growth plate fracture. Okay.